get it all synced up and connected, so we're just letting it do that. Hey, we got green lights. Welcome, happy Wednesday. This is Dr. Sean McWilliams, and welcome to Back Talks, where we are a community of people that want to manage and keep our spines healthy naturally without medications and without drugs and without dangerous surgeries and addictive types of medications. So it is great to have you here. If this is your first time, please say hello. I'm going to switch over so I can see everyone. Hey, sometimes you have to do it twice, just so you know. Sometimes Facebook and YouTube, the comments don't always come through. So if you don't see me responding and you said hello to me, please click it again, send me another one, or refresh your browser, and that'll usually fix the issues. So if you are here, welcome. It is great to have you here. We've been talking about something really big. We've been talking about different vehicles that people have been used or are suggested to use from doctors on managing chronic spinal pain and back pain. So we've talked about those over the last couple of weeks, such as microdiscectomies, facet injections. Of course, there's ablations, fusions, epidurals, just off the top of my head. So we're going to talk about one of those vehicles today, and that is spinal fusion. So let's get to it. Spinal fusions, unlocking the truth. Everything that you need to know, the pros, the cons about getting spinal fusions, when to do them, and I want you to know your other non-invasive options. So what is a spinal fusion? Well, a spinal fusion is just this. It is also known as a spondylolisthesis. It is a procedure performed by an orthopedic surgeon or a neurosurgeon to fuse two or more spinal bones together. That is it in a nutshell. Typically using big bolts and screws like you're seeing over here to the left of me, over here, to some capacity just like that. It can be performed at any level of the spinal column, and it prevents movement of the fused vertebrae. It prevents movement. That is the entire purpose of it, is stability and the prevention of movement. So are they necessary? Well, yes, in certain circumstances they are necessary. So let's look at that. Severe scoliosis. A lot of them can be managed without it, but I've seen some really, really severe scoliosis that people typically have a better quality of life if they have fusion. Severe fractures, severe instability of your spinal column, and if you've had a trauma, which usually leads to fractures and instabilities, is trauma. However, I want you to look at this statement right here. Spinal fusions should be reserved when other more conservative options have been exhausted. That's right. I'm going to read it again because it's really important. Spinal fusion should be reserved when other more conservative options have been exhausted. Well, why is that? Well, because there's a lot of other really great options for you that don't involve surgeries that are massively invasive like this. So one of the things you have to understand if you do have to get a spinal fusion is a thing called axial stress. And the reason I'm bringing this up is because I've worked with lots of patients that had spinal fusions over my last 25 years of practice. And you have to know they are still typically in pain. But where they get their pain out a lot of times is the area above and the area below the fusion, like you can see right here. So where you see these two red arrows at, those are the bones that are non-fused. And then you can see the ones here, here, and here that are fused, and then the ones that aren't. And usually the people are going to come in, they're coming in with a lot of pain, typically, especially in the low back, especially down here at this L5, S1 level right there. That's usually where I see a lot of their back pain, but they'll also have back pain up in this area too. So why does that happen? Well, it happens for this reason, and that is when you fuse this, when the spine is healthy and it's working properly, it's like these people in the blue shirts right here holding this big long log, 6 of them all equally distributing the weight of the log amongst all 6. So that means that one person isn't just carrying the load, or 2 of them. So all 6 of them. So it makes it much more manageable to manage the weight of those. And that is exactly what happens in our spinal column when it's working properly. However, what happens if we take this lady, this guy, and there looks like there's another lady right here. There's her arm, and they all let go and walk away. Now this gentleman and this gentleman back here now have all the load stress, and what winds up happening is you go from people that can handle it to this gentleman right here, where is using every single thing that he has to help keep the weight of that log up on his back. And that's what happens when we get our spine fused. And that's why you'll see people that even when they get it done, to address one issue, they wind up causing another issue, and they wind up causing this situation in their low back. And I don't want that happening to you unless it's absolutely emergency and you need to have it done. Another reason that you have to be really, really careful of spinal fusions is what's called post-fusion neurological scar tissue. Okay, and what that is when your body starts to, after you do surgery and you cut tissues, there's always scar tissue left over, and that develops. And if you see all this white area in here, that is a post-fusion neurological scar. And unfortunately what that does is that it actually creates a spider web of scar tissue, and it wraps around your joints and your nerves, and that's exactly what you're seeing taking place right here. So this is your spinal cord. You have a nerve branch that comes off, goes through here, okay? And now you have this, instead of that being nice and open like it's supposed to be, this big open tunnel, now you start getting this scar tissue. And usually what winds up happening is that most people are in pretty good shape for their first year, but after around year 3, this scar tissue starts to form, starts wrapping around that nerve, and it'll start grabbing hold of that nerve a lot of times, and now you start getting neurological pain because of the scar tissue. And the worst part is that most surgeons will not go back in and try to correct that because they have no idea what they're getting themselves into. And they don't want the liability of it. So now you're stuck with chronic back pain for the rest of your life because of a surgery. So I don't want that happening to you, okay? And in probably 80+%, maybe even 90% of the cases, this isn't even necessary. It's not necessary to get fusion in your spine. Now, what are some other negatives when it comes to doing spinal fusion? Well, you better have a big, deep pocketbook. And because I know people are in pain, but you got to realize these numbers right here. So spinal fusion right here, second most expensive surgery that you can get for men and women. On average, $138,460 to get a spinal fusion. Yep, that's right, $138,460. So let's say you have a $10,000 deductible. You're responsible for all $10,000 out of that if you have insurance. People go, well, I have insurance. Okay, sure, I get that. You have insurance. So let's say you have a $10,000 deductible, and that's pretty normal these days, just so you know. Then let's say you have a 20% coinsurance. Well, 20% of $100,000 is $20,000. Go to another $25,000. We're not even $138,000 yet. So now you have what, another you got some big money going out there without me being able to calculate all this in your head. But you're looking at, you probably are going to have the expense of at least probably $40,000 to $50,000 on your own that you will be responsible for. And you know what? I bring this up because that's not an empowering place to be. You know, your back was hurting you. Someone talked you into doing a spinal fusion because they make a ton of money, which you're going to see here in a second. They get to practice. As long as you stayed alive, the surgery was successful. You know how I feel about that. I don't feel very good about that at all, because at the end of the day, first, do no harm in the Hippocratic Oath. And we got to really look at, there should be other options that you should be exploring before you go and get the most invasive thing that you could possibly get done on your spine, which is some sort of spinal fusion. So you're talking big dollars. So now perhaps you're feeling a little bit better from your back. Maybe you're feeling worse, but now you owe $45,000 to $50,000 on top of it. That's not an empowering place to be. And that's for a $138,000 surgery. Most of the surgeries I'm seeing right now with artificial discs that they're loving doing, and some of these other procedures, you're talking $250,000. I just had one of my patients that didn't want to do spinal decompression for some unknown godly reason and didn't want to commit to it. $575,000 $20,000. So you think about an deductible of $10,000 to $20,000, and 20% of that number, you're talking massive, massive out-of-pocket expenses. And I don't want that happening to you. So you think I'm joking with this? No, I'm not joking with it at all. The average settlement for spinal fusion cases, according to this personal injury firm, is spinal fusion surgery claims typically range between $150,000 and $600,000 for a spinal fusion. And here's the crazy part. And in some cases, they have reached settlements as high as $12 million, depending on the factors of the severity of the injury. And yes, those attorneys make money on that, and that's why they like sending people for these, because it's big bucks for their settlements and for their clients. But if you're the client and you've had this and you're no better or you're worse, you got to live with that for the rest of your life, just like my uncle had to. And I don't want you looking like this for the rest of your life, having big, massive scars and bolts and rods in your spine if you don't have to, because most of the time you don't have to. And here's what's happening in the global spinal fusion device market. 2022, the global market was $6.9 billion is what we were spending on that. Check this out. By 2032, it's going to be $10.8 billion. That's 10 years, and it's almost doubling. So what's that mean? That means that a lot more doctors are doing a lot more spinal fusions and using hardware in your spine. And the only way that you get to have a spinal fusion device in your body is because some surgeon talked you into getting it done and didn't give you and guide you correctly on doing something non-surgical for at least 12 weeks that has very high success rates, and that's proven by research, and that's computerized or spinal decompression, either done in someone's office or soon to be the ability for you to do it at your home. So if you don't know this information, the chances of you getting tricked and fooled out of fear and pain into getting spinal fusions is very high. That's why I do this stuff every single week. So do you have other options? Of course you have other options, and 80+% of the time you have other options, and spinal decompression addresses most spinal issue pain. That's facet-based pain and discogenic pain and some stenosis, especially if it's caused by a bulging or herniated disc. So it's an amazing case. Does it work? Yeah, it works. Works phenomenally well. Look at my patient. Here's one of my patients right here. Massive herniation, severe low back pain, sciatic pain, weakness in his legs. I see this stuff. You know, you guys are, if you're suffering with this, it's very common, right? Almost none in 12 weeks. No pain in 12 weeks. That didn't convince you? Here's another gentleman. You can see these bulges of his discs right here. Okay? You can see right here, that little white line is just a little bit of his nerve branch. It's showing on the one side. You can't even see it on that side going down his left leg. 12 weeks later, no bulge whatsoever. And look at this guy. You can see his entire spinal nerve root right there on both sides, almost the exact shape they're supposed to be. No pain. Hey, Stephanie, great to have you here. I'll definitely let Marie say you said hello. You don't believe me? Here's another one of my patients, and you can do this stuff from home. Massive disc herniation. Massive herniation right there. Sciatic pain going all the way down their legs. Severe low back pain. Was told by four surgeons he needed to have an operation to fix this. Oh, yeah? 12 weeks later, my patient, no herniation. Almost, you can see the massive change in his herniation right there. No back pain in that point. Out hiking again, being the dad, amazing dad that he is right now. So I want you to know that please, please, please try conservative care first. I don't care what your surgeon says. And if you need guidance, that's why I do this every Wednesday. And we're launching our course that I've been spending over a year on, easily, probably a year and a half of creating for you to be able to bring you the really most up-to-date scientific care available that you can do from the comfort of your home, and you can get changes like this from the comfort of your home with me being your teacher and guiding you. All you got to do is do a little bit of the work, okay? So we'll be showing you that next week. We're super excited. to share this with you and share Disc University with you. So please be on the lookout. We'll be sending some great stuff out. Does anybody have any questions for me on spinal fusions? It is a big thing these days. I'm seeing more and more and more people in their 20s on Facebook groups for herniated and bulging discs getting fusions and having fear put into them by these surgeons to make them go and do these surgeries that are so unnecessary, that look way less than this in most cases, and they're going and getting their spines fused, and they're never going to be the same again. And I don't want that happening for you or anybody that you care and love about. Before you do that, you talk to me, okay? And I'm going to help guide you. And if I feel like it's the right thing for you, I'll even tell you that. All right? So you guys are awesome. So it is always great. Next week we'll be doing our official launch, so please be on the lookout for this. Hey, if you like the information that we put out for you and you feel like this is helpful, please, hit the notification bell so you get every latest video that I put out. And we put out videos every single week on different topics when it comes to spinal health and management of that non-surgically and sometimes surgically too. I try to give you both sides to it. I hope you share this video with other people and subscribe to us if you feel like I've earned the right and I've given you good information that's made a difference in your decision-making process so you feel more informed. I hope that you'll join our family, our growing family, and subscribe to our channel. So ladies, always great to have you here as always. I hope you guys have another beautiful day in your life. I hope it's beautiful and sunny up in Pennsylvania as it is here in Georgia again on a Wednesday, as you all know. Something pretty magical about Wednesdays. Maybe it's when I do my lives. God wants it to be nice and sunny for me. I don't know. But it's great to have you here. Thanks for being here. If you don't have any questions that I could answer, we'll say bye. If you do, we'll hang out. Would love to answer them for you, but I hope you have an amazing day. And thanks for sharing this with other people. And I hope that you feel the most educated amongst all your friends and family when it comes to spinal health, because I sure work hard to try to bring you some really great content and information. So if you don't have questions, I will see you next week, same channel. Oh, it's sunny there. Oh, I'm so glad, Stephanie. That's awesome. Will you enjoy that sunshine and give my love to you and your family, okay? And thanks, Marisa. Always great having you here. See you guys next week.